Shine with Njoki Kamanja Kethi.
And now we want to let her know what are the signs of labor.
Okay.
When does she know that now I'm in labor?
Yes. And that's an area, and thank you so much for asking that question, because that is an area that presents a lot of confusion to women, especially first timers.
Okay.
And some even get to a point of delivering in cars and matatus and the market and their workplaces.
And the roadside.
Yes, because they assume this is normal. And others tend to really spend the entire week in the hospital running because they're afraid. They see one thing, they run to hospital. They see one thing, they run to hospital. But I would say that the labor is divided into three stages. We have the first stage of labor, second stage, and third stage. But before you come to the first stage, you have the latent phase. The latent phase is a period before you're fully, when you just starting to dilate.
Okay.
Yeah, when you're starting to dilate. And that, especially for first timers, it can take really long.
By dilating, you mean the opening,
of the cervix.
Okay.
Ideally, the cervix starts at 1 centimeter. And it has to go to 10 centimeters. This scares women.
This is the war place,
yeah,
the
because
place of
there are
war.
women who have gone to hospital for other tests like pap smear, and there are metals that are put in there, and once they are opened up slightly, they really feel a lot of discomfort and pain, and therefore they ask themselves, now this is just a tiny procedure, just a small opening. Now, and they look at the head of the baby, and they look at themselves, and they're scared. How will this baby? But I would want to tell you that once you get pregnant, your entire system prepares itself.
Okay.
For the passage prepares itself. Inside the birth canal, there are some rough edges, protrusions that are called rugae.
Okay.
And these rugae, they are there.
That sound wrong, guy.
Yeah, but they are called rugae. They are there. Number one is for sexual pleasure.
Okay.
But most importantly, is for preparation of birth.
Okay.
And therefore, the vaginal canal opens up, and the rugae straighten up, and therefore it provides allowance for stretching up.
Okay.
But due to the hormones and all that after delivery, they come back. Yeah. But there is a very important thing, or anatomical structure, that is called the cervix. It's the opening of the womb, or better still, the uterus. It starts opening like the size of a grape. See the size of a grape?
Yeah.
That is almost 1 centimeter. And it progresses slowly. And before it gets to 4 centimeters, that one may take, for some, may take even a week. Especially from 0 maybe to 2.
Okay.
Unakimbia hospitali, nimesikia uchungu sana hapa, nimeona kauchafu. You see now, there's a mucus plug that closes the cervix, that prevents germs from getting to the baby.
Okay.
This mucus plug has to get out. Some people gets out early.
Okay.
That's why we hear false labor. Starts to get, unakuta sasa uko very wet during the last stage, the last week, the last 2 weeks of your pregnancy.
Yeah.
Unakuta you can produce like a pale mucus, like substance. Kidogo kidogo it may come like a constant stream. Some may come out like just one plug.
Okay.
So inatoka tu pole pole. Some wanaweza kosa kuexperience itoke na mtoto.
Okay.
Okay? So that mucus plug is one sign that you are approaching labor.
Okay.
It's called show.
Oh, yeah.
Some people experience dark red mucus. Yeah, that is normal, and you should not be worried.
So this forced labor is the Braxton Hicks?
Yes, not Hicks, Hicks.
Hicks,
Braxton Hicks. Those are short contractions. The uterus is a muscle. And there's a genius way that it contracts, not like any other contraction. It contracts in a way that we call contraction and retraction. I know these are very major, the big
By
terms.
that you mean it's...
No, it is divided into two segments,
Okay.
the upper segment and the lower segment, okay? Now, technically, this small part must open up.
Okay.
This lower part must open up to allow for the baby.
Okay.
And this upper part must contract
Okay.
to push down the baby.
Oh.
So they are moving in two different ways. One is
This one is
the upper
opening.
part is contracting, and this muscle is not like any other muscle. Again, you see, God is a genius.
A genius.
It retains the contraction. Like ikicontract hivi hairudi tena. Hapana. So ina shorten.
Okay.
Hii ya juu ina shorten. Ina shorten.
inafinyia
So it
mtoto.
like ni kama sasa
It's like
balloon.
sucking out.
It's like a balloon iko na maji ndani, then unafinya pande ya juu.
Oh, yeah.
Na ukifinya ukiwachilia hairudi, inabaki vile.
Okay.
Every contraction inabaki vile. But now the Braxton Hicks contractions, they start even 2 weeks or 3 weeks earlier. And these are just electric currents that are passed through the uterus to prepare it for the contraction.
Okay.
So these are not true labors, but unaweza feel uchungu hapa and a lot of pressure down here. Unasikia kama unadungwa huko chini, unasikia huko chini mgongo ya chini nauma sana, unasikia miguu zimeganda, hata kupanda stairs ni shida kabisa.
Yeah.
Those are signs that you are approaching.
So Braxton Hicks are like it's a message. They are sending a message. Now we are almost there.
Yeah,
Okay.
but also they are sending more than a message. The Braxton Hicks is just mini contractions.
Okay.
And they will continue. Braxton Hicks lasts for seconds, but as you progress towards now approaching labor now, now this Braxton Hicks changes into contraction.
Oh, yeah.
It's the same Braxton Hicks that changes into contraction. It lasts like 15 seconds, but and once it relaxes, it does not stay for long.
Oh, yeah.
So that's the time you realize that I am in labor, and these are signs of labor.
Okay.
Number one is the show. Number two is the contractions become much stronger. They last much longer.
Okay.
And it takes a shorter time for them to rest, then they come back.
Okay.
Okay? Those are major signs of pregnancy. But labor. But most importantly is the breaking of waters.
Yeah.
Yeah.
But now there are women who don't break water.
Yes.
Yeah.
But why, the reason I'm saying it's very important is because now once the waters break, you know, the cushion and the environment that the baby is in has really been altered, it has been changed, and therefore you need hospital care.
Okay.
Before then, and this is what mothers should know, the hormone that is responsible for labor and contraction is called oxytocin.
Oxytocin.
Yes.
Yeah.
Do you
we
know?
learned it in biology.
Yes. Do you know you produce that oxytocin every day? Even when you're not pregnant. It is a feel-good hormone.
Okay.
Yeah, but it's usually produced when you're cuddled, when you're touched, when you're hugged. That's close contact.
Okay.
You produce that hormone. So it is a hormone that is produced when you are relaxed.
Okay.
So if you want to increase it and to have a smooth labor, what does that tell you? You should really be relaxed.
Relax.
Dark place, relaxed. And we say for so mostly, especially the people who go to general hospitals or public hospital, it is very hard to create that environment. Kwa sababu kuna mtu mwingine yuko anapiga daktari kuja.
Yes.
Mwingine anapiga huko anatukana mzee wake. So the environment is so the environment is a little bit confusing and it creates a lot of anxiety. So we tell women not to really rush to the hospital. To do part of the
labor.
The labor, especially before you come to the latent phase, at your home, taking what you like. With the and we also encourage you to have a birth assistant.
Yani hapa tu ni
Or a
self-care.
birth companion, yes, self-love, or a birth companion, and a person who you treasure their touch.
Wow.
So that when these people touch you, you produce that hormone, you feel good.
I should have known this.
Yes. We encourage, and in the recent years, even the hospitals, we are encouraging partners in terms of the husbands. For very many years, and I think we should be advocates of this.
Yeah.
Men have been really put aside. Ni kama wao ndio wamecause kitu mbaya sana ifanyike.
You know what they
wanakaa
say?
mbali huko.
They say sasa akikuja anione, after this hata nipenda.
Yes.
It's traumatizing to them, and I always ask myself, it's traumatizing to me who is giving birth. Wow.
But we are seeing men who are coming up,
and
they want to be there. These days we encourage them to be there, to do the back rubs for their women, to talk to them, to hold them when they're having labor, to wipe their sweat. We encourage them to do some certain maneuvers, and that one we will talk when we are talking about delivery. There's some certain maneuvers that will help the labor to progress quickly and very well. We encourage men because they have the strength and their touch helps the women to produce this oxytocin hormone. And if they don't produce it during the labor, that's when we talk of induction. We give them this. Unasikianga ameongezewa maji ya uchungu. It is now, but when it is produced naturally,
mkwe na kitu ingine
haikangi bure, inakanga wakati umehitaji zaidi, and it is very essential because inasaidianga ku fasten kuharakisha ile delivery, mtoto asichoke. And wakati badala ukae hapo, I'd rather nisikie uchungu mara moja kuliko kukaa hapo the 24 hours. Nisikie uchungu mara moja, reduced number of hours.
Okay, now we are here. We are ready. The baby is coming.
Yes.
Everybody is anakuja. Women shout.
Yes.
Ndio huyo anasikia kichwa. So we are here at the delivery.
Yes. I think there's something we are skipping. Before we reach there. Because women need education, especially on how to labor.
Yes, please.
And that is a very important. Number one, I've said you need
on how to labor.
How to labor.
Wow.
Number one, I've said you need a very relaxed environment. When you're shouting and when you are ngine unawatoa chini ya kitanda huko, wewe unafanya nini huko? Anyway, that's on a light note. But there are people who do very funny things. Unashika chuma, unataka kuvunja, unajiuma, and you realize those things do not in any way. I understand. Let me tell you,
that pain is unbearable.
If for women who have delivered, they most of them don't compare any other pain.
Actually, you can't.
Yes. So, and if you are shown on a scale the level of that pain, you say, women, Igwe, you are strong.
Please respect.
Yes, you are strong because that level of pain is on another level or on its own. But we are saying it is possible for you to go through labor even without doing a lot of gimmicks. Because once you are jumping, you are doing all those things. Number one, you are using up a lot of energy that you require during the last minute of pushing. Number two, you are causing yourself to really prolong your time because you're not producing the oxytocin properly, and therefore we'll have to induce you. Because oxytocin is produced when you are calm and you're trying to calm down. So we say that number one, you should avoid pushing before you are told by the doctor to push. Because I said that you start with, when we do a vaginal examination, the cervix is the size of a pea, or sorry, a grape. But it goes to the size of, an orange yenye imekatwa katikati ya good size. That's 10 centimeters.
Wow.
Yes. Like we use these two fingers from here to here. This is 10 centimeters, even if you measure. So we say that for that journey, you see, the head of the fetus has to press on the cervix. Yenye ndo inafunguanga. So the more ina press, the more inafungua. Yenye inajitafutianga space mpaka ifunguke, ifike that size. So we are encouraged, when you have contractions, don't shout. Try and breathe in and out. And control yourself. And that time, because when there are contraction, blood vessels pass through the muscles of the uterus. But when you're contracting, the muscles zinafunga the blood supply to the baby.
Okay.
Na ukishout unatumia more energy na more oxygen, unapiga nduru, then una reduce hata ile oxygen nafikia mtoto. Sasa unasikia mtoto pia ameanza kuchoka. So we are telling you to breathe in, upatie mtoto hewa. Now it does two things. It increase the level of oxygen in your system. Number two, you cannot push while you are breathing in and out.
Yeah.
Because once you are pushing in a place that is not open, ina irritate ile area, now you start getting inflamed. Ama kufura. From the inside and from the outside.
Wow.
So instead ya ile, alafu cervix ambayo imefura, haizangi kufunguka. We prefer a very thin cervix. Because a thin cervix inajivuta vizuri. It's like a bladder. Upatiwe bladder inatoshana hivi. Na upatika bladder kakonde. Gani tutavuta haraka? Ile konde. So when the cervix is thin, then you contract very fast. But ukisukuma tunafikiria unaharakisha, ati wacha nisukume niharakisha nitoke hapa, ndio sasa unafanya the opposite. So we encourage you to do what? To breathe in and out. It's not as easy as is said, I understand.
Yeah, because the pain.
Yes, but it is doable.
Yeah.
Yeah, and that's why we say we need a partner who is able to make you relax. And usisugue tumbo. Ukisugua tumbo, unaongeza uchungu because una stimulate contractions.
Oh.
Yeah? But kenye tunataka kuna nerves ziko hapa kwa back. And then that's why we say we encourage men because men are strong. If they apply pressure at the back, not just rubbing, but kama kufinya ndani, then it relaxes this muscle na ina straighten hii bone yenye iko hapa nyuma. Yeah, kuna bone imekaa hivi na mtoto lazima slide hapo. But once the bone is a little bit straight, then mtoto atatoka haraka. Okay. So wakifinya hapa kwa mgongo, at least inasaidia ku straighten the back.
Wow.
We also encourage ambulation ama walking around because of gravity.
Oh.
Yes. So ukitembea then unashikilia mgongo, unashikilia kitanda yako kama umeinama, then unaswingisha kiuno. Tunasemanga unacheza dombolo. Cheza dombolo. Yeah, because ukicheza hivyo ni kama unatafutilia mtoto, anatafuta tayari mwenyewe, anaweza kumanuva his way around. Yeah.
Wow. Now the baby is ready to come out.
Yes.
When does the doctor determine the mode of delivery? Because there are people amefunguka kabisa amefika 8 but sasa hapa sasa ni cesarean.
Okay.
Ama amefunguka vizuri, we are receiving the baby, that is the vaginal birth.
Yes.
Yes, and now the delivery process.
Thank you so much for that question. We say that a pregnancy can be at risk at any stage.
Yes.
The moment you get pregnant, at the first trimester, at the second trimester, during the first stage of labor, during the second stage of labor. Sometimes the head, kuna vile inafaa kutoka.
Yeah.
Itoke na the smallest dimension. Ambayo ni kisogo. Sasa inafaa sasa itoke na ile the smallest area, ndio ikikujanga na the bigger area inakuja kama imejifungulia njia.
Okay.
Lakini ikianza na the bigger diameter, then itafunga ile njia. But there are people ambao amekuja mtoto anaendelea vizuri, but inafika mahali anakosa kuturn, atoke na kisogo, inakuja maybe face inatoka mbele. And that one we call face to pubis. Na unajua hii dimension kutoka hapa mpaka hapa ndio the biggest.
Yeah.
Compare na hii dimension kutoka kwa kisogo hapa mpaka hapa.
Yeah.
So hii kikuja ndio ina face the vaginal canal, then unaweza ona mtoto ndio huyu, lakini mfupa iko hapa na mfupa iko hapa. Hauwezi lazimisha huyo mtoto kutoka.
When they are giving birth.
Yes.
What would cause this baby who is supposed to come out this way na kisogo for them to be facing with the longest diameter, or they just stand in between?
There are very many types there are several types of pelvis. Kuna pelvis ya wazungu iko much more straight.
Okay.
Na Wahindi. Pelvis ya Waafrika slant kidogo imekuja nyuma kidogo.
Okay.
But Indians have a pelvis that inafanya mtoto akitembea akienda aendi straight, anapiga very many maneuvers.
Wow.
Na sometimes anaweza slip akuja to phase of pubis.
Okay.
The other people of African descent who have the same type of pelvis, though that one determines.
Okay.
The other determination is most probably maybe the child, the maneuvers ambazo child anatoka nazo, the mtoto anatoka. Akimake a wrong maneuver tu kidogo, akose kuchukua the right turn, it's like you're in a cave. You take the wrong curve, turn, and unapotea. Yes, so lazima afuate ile pattern ya delivery.
Okay. So now let's talk. They have given birth through the vaginal delivery.
Yes.
The baby is here. That post-delivery care. Yeah. Before we talk about now, I believe cesarean care and vaginal birth care is different.
The immediate care, might be different.
Yeah.
But the subsequent care is the same.
Okay.
Why do I say that? Immediately after we get the baby out, this day we want to do what we call skin-to-skin care. So once we get the baby out, we just tunampanguza vizuri, then we place the baby in contact with the mother directly, before even cutting
The umbilical
the
cord.
umbilical cord. We get the
baby.
baby. We make sure the baby is clean, no secretion in the mouth. The baby is breathing well. It's called what we call spontaneous respiration. Then we place.
Have cried.
Yes, that is what we call spontaneous respiration.
Okay.
So we place the baby on the mother's chest, skin to skin. At the beginning, I said the oxytocin is produced when there is contact.
But at this point,
touch.
we are allowed to shout, "Thank you, Jesus!"
At that time, you can celebrate the best way you know. Yes.
At least you're allowed.
But safe celebration. Yeah. So we place the baby on the mother's chest. That helps to produce oxytocin. The mother produces more oxytocin.
Okay.
That will also increase the contraction, because remember, we don't just birth the baby.
Yeah.
We also birth the placenta.
Yeah.
And we require this contraction to birth the placenta.
Okay.
Also, the oxytocin helps in milk production. So there are two things, for the benefit to the mother and the benefits to the baby. For the infant, once the baby starts breastfeeding immediately, then the baby establishes lactation very fast. Because if you delay, nasikia mtoto wangu anakataa kunyonya.
Oh.
Yeah. Because we call it the instinct is very active in the first 30 minutes
Wow.
of labor,
And
of delivery.
this skin to skin, does it happen to both cesarean and vaginal?
Yes, it happens, especially these days when we are doing the half
Okay.
block, nerve block.
Okay.
So you're able to touch your baby, to cuddle your baby, to look at your baby. So it's very important that the mother holds the baby. Then from there, once you're there with your baby, we attach the baby to your breast once you're still there, and the baby is kept warm. Now this is the time we come and you take what we call a cord clamp, a plastic cord clamp. We place it on the rear end, at around 2 centimeters at the rear end of the baby. Then we leave another 2 centimeters space. Then we have a metal clamp that we clamp on the maternal side. Then we cut the cord. So you're left with the baby. Now these days, because we are encouraging partners to be there in the maternity, there are men that really we give them an opportunity to come and cut the cord. Yeah, and it is a very good feeling even for posterity.
Cut the cord.
Yes. So from there, we give within the 1 minute of delivery, we give you an injection of oxytocin. Now we know you produce, but we give you a synthetic one to also prevent bleeding, because I told you the blood vessels pass through the uterus. So we have what we call living ligatures. Once the uterus contracts, it inafunga mishipa za damu, inafunga, so that you are not able to and this we will discuss later on,
Yeah.
because we know we have other episodes
Yeah,
on
true.
abnormalities during and after pregnancy. When you're discussing abnormalities during after pregnancy, the third stage of the third stage of labor, we will talk about what we call PPH, or postpartum hemorrhage.
Okay.
This is where you continue to bleed even after delivery.
Okay.
So oxytocin helps to
close.
and also you're breastfeeding, it also produces oxytocin, and then it helps to stop the bleeding.
Okay.
Yeah, I think that is good information.
Yeah.
Finally, we clean you, we make sure that we have removed. Now this is where most mothers, when the baby has come out, of course there are lacerations there, mekatwa hapa kidogo, maybe the vaginal canal was not, the size was a little bit smaller, and we had to increase the opening by doing what we call an episiotomy, cutting one side or both sides, what we call bilateral episiotomy. So there are still wounds there, the place is very sore, and we still have to go in there and clean and make sure that you're very clean. Hapa ndio mama wanasumbua kidogo, wanasema, but it is very important.
Yes, you have already gone through labor. Now you are laboring again.
Yes, because if you don't do that, utajikuta tena ile damu ikifika pale imejaza uterus inashindwa kucontract, so unaendelea kubleed. Afadhali tutoe yote, make sure you are clean. That small few minutes will save you a lot.
Okay.
Yes.
Wow, and this is where unashonwa.
So there, kama ulikuwa umekatwa, unashonwa, na sio uzi za kutolewa. Ni uzi zenye inategemea ulikatwa. Sometimes hata mtoto anaweza toka na force. Of course we try as much as possible to avoid tears. Na wengine wanasemanga usinikate. I'd rather nikukate, because nikikukata nitakata straight line. I know it's gross.
Yeah.
It's not sound well. For me naisema kama kawaida, but not too many. It's gross. But I'd rather nikukate, nikate straight line.
Okay.
Yenye nikiweza kushona nitakushona vizuri. Kuliko mtoto atoke ya kukate, atakukata very rugged, very deep, na atakata directions ambazo inaweza kuja. Sisi tukikata tukukati chini, tunakata cross to the muscle. Lakini mtoto akikukata kwa sababu kuna straight line hapa, atakata itaenda mpaka iguze njia ya choo, anus. So utakuta unasikia mtu akienda hospitali, na this will also discuss, anarudi hospitali ati choo yangu inachanganyikana na mkojo.
Okay.
Kwa sababu ilienda ikakata ikashikanisha both the vagina and the rectum. Yes.
Wow. Hey, and now for the cesarean,
Yes.
the care.
The care for the cesarean, the only difference is that now here hatutakuingiza, hakuna kutoa hiyo third stage of labor, hakuna kutoa placenta, because tukitoa mtoto pale ndani tena tunatoa placenta na tunaosha ndani na tunashona na hausikii uchungu, but later on utaendelea tu kutoa for like 8 days to like 2 weeks. Utaendelea bado kutoa uchafu ile uterus, na nisiite uchafu kwa sababu basically sio uchafu, but of course utaendelea kutoa damu. Inaanzanga ikiwa bright red, inakuja inaanza kuwa pinkish, cream, inakuja na kuwa cream, inapotea.
Wow. So now our baby is here. We are happy. Baba mtoto has received the child or the person around them. Now we have the postnatal care. Let's talk about it.
Now, one thing you should realize is that the first 28 days of the baby's life, of the infant's life, is very critical. And that is where we lose most children. That is where we have infant mortality rate of the death.
Okay.
And morbidity, that is mortality meaning death, morbidity meaning sickness. High mortality and morbidity rate is within the first 28 days after delivery.
Okay.
And therefore you should really usiseme nimemalizana na daktari na nimepata mtoto sasa ni hapana. We say that the first antenatal check-up should be within the 24 hours.
Okay.
Within 24 hours tunaangalia wewe kama bado nyungu ya uzazi inaendelea kurudi vizuri, kama ulishona huko chini kwa sawa, kama damu is consistent with what should be there.
Okay.
Tunaangalia kama mtoto ana breastfeed vizuri, kama umedevelop infection yoyote, kama mtoto amedevelop infection yoyote.
Yes.
Tunaangalia mtoto head to toe examination, kama kuna any congenital. That one is done within the first 24 hours. Congenital abnormalities, kama anakojoa, anapass urine, anapass stool, kama ana breastfeed vizuri. And all that tunaiangalia within the first 24 hours.
Okay.
Then we record that in your card
Yeah.
and we release you. These days, we encourage postnatal examination, postnatal family planning.
Okay.
Yes, within those 24 hours. Kuna zile methods. Actually, kitu kama coil inawekwa within 30 minutes of delivery.
Wow.
Yes. Also, we are using other methods because we realize that people go
6
and
weeks.
when you are waiting for them to come after 6 weeks for this family planning, they come
They are
when they are already
pregnant.
pregnant. So to avoid this, we are doing what we call postnatal
But are
family
the men
planning.
supposed to go there in the first 6 weeks?
There are
I
men
mean?
considering that men maybe walikuwa wengine wamedelay, wamekosa kuwa pale maybe a month or 2 before.
Has
Sasa
this
mtoto
person
ametoka
healed surely?
and sasa mzee anasema hey, finally
Game time.
yeah. So we have heard of cases ile mama ametoka hospitali amefika nyumbani na ameanza kusumbuliwa na mzee.
Oh.
So those are there. Maybe it's not confirmed. We have heard, but what we are saying that it is possible,
Yeah.
and therefore to prevent that, we encourage postnatal family planning immediately. Then we give you a return date. We insert you in our calendar. You're supposed to come after 2 weeks.
Yeah.
2 weeks, we also check the same things. The uterus is supposed to go back to the size ya ngumi. Kwa hivyo inafaa irudi pole 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 pole. By the time unakuja second week, inafaa kuwa at least imeteremu. But ukienda nyumbani watu nafikiria bado uko na mimba kwa sababu tumbo bado ni kubwa, uterus bado ni kubwa. But after 2 weeks inafaa kuwa imeingia, we check. Is it retracting? If it is not retracting, then kuna ishida.
Yeah.
There is what we call piperosepsis. Maybe during the process of labor kuna infection iliintroduciwa. Mama anaweza kuwa anakuwa na bleed sana after 2 weeks.
Yeah.
That's called piperosepsis. Mwingine anapata what we call PID, pelvic inflammatory disease. So those are things that we check after 2 weeks.
Okay.
Mtoto anaweza pata jaundice. Yeah, because ya infection. Tunaangalia ile code. Of course tulikutrain kuhusu code care, vile unafaa kushughulikiwa. Tunaangalia kama it is healing, kama imeanguka, if it is okay. Tunaangalia mtoto kama ananyonya vizuri, kama ako dehydrated. Some people unaona hii shimo imeingia ndani kabisa, macho ziko ndani, ako dehydrated, hajakuwa kinyonya vizuri. Yeah, we at that time we also check on that.
Okay.
Check the temperature, kujua kama wewe uko na infection, blood pressure. Kuna watu ambao wanapata hypertension during delivery.
Yeah.
There's another thing. Kuna kitu inaitwa tutaiongea. We can talk about that later on. This is what we call piperopsychosis. There are people who get depressed immediately after delivery. Other people get into a psychosis ile wanakuwa like they hawajielewi kabisa.
Okay.
Yeah, especially if they didn't get enough support during delivery.
Yeah.
The process was beyond what they imagined.
Okay.
Yeah, so
Is that what we call postpartum blues and postpartum depression?
Yes, but it goes much more beyond because it becomes like a psychiatric condition.
Okay.
Anaweza hata toka kwa nyumba atembee kama mwendo wazimu uko nje kabisa.
Oi.
Yes.
Wow.
Yeah, so after that we give you another visit after 6 weeks. This is where you come. Tunapatia mtoto shindano za kwanza kwa sababu akiwa hospitali alipata hii BCG within the first 24 hours na alipata first polio oral polio. But now tunaendelea kumpatia hizi za miguu sasa. Bado tutaendelea na oral polio na zingine ziko hapo ambazo lazima tuendelee nazo. We also at 6 weeks is when we weigh the baby to see now to start tracking the weight. Yeah. So basically that is it. We also, for them that did not adapt a family planning during postnatal period, then this is the time now we need to give to cancel.
Okay.
And we encourage partners them to come with their partners.
Okay.
And these days that tukiangalia hospitali, we encourage partner involvement. Na kwa sababu wanaume wajui kukaa katikati ya wamama wengine wakikojoleango na makelele huku, we give them first preference. We kuja na mzee ingia kwa kwanza. TV pale hatuweki Telemundo na vitu zingine. Tunaweza weka hata football Premier League. Wakae hapo kama waone. So we are encouraging them to accompany. Yes.
Wow. So up to that point, that is when now, like, that is what happens in the postnatal care now
Yes,
as
yes.
you continue with the vaccines
Yes,
mtoto
yes.
akigrow.
Yes,
So
yes.
thank you very much.
Karibu sana.
We have learned. Kwanza vile una insist hapo kwa men.
Yes, very important.
Yeah, I'm with you.
Very important.
Men, you
And
have
I'm
been
leading
taken-
by example.
Thank you.
Yes.
Yes?
Yes.
Yes. You should start a WhatsApp group. A WhatsApp group of men to support women.
Sure, sure. It's
But
very
because
important.
the giving birth and the pregnancy journey,
Yes.
I always imagine those people who do that journey alone. It must be very stressing.
Sure.
You're craving sugar. You can't taste sugar because now there's nobody to provide the sugar.
Sure.
Yeah,
And
so-
research has shown
Yeah.
that it actually is documented that the people who are supported, especially by their male partners, it's not basically the care
Yeah.
that they got in the hospital that they remember, even if they got first 5-star
Yeah.
treatment, because at some point these people are doing their work.
Yeah.
But the care that they get from their partners is what they carry along and is what reduces the postpartum blues, as you mentioned,
Yeah.
and the postpartum depression and the puerperal psychosis.
Okay.
Yeah, the partner involvement really goes in a long way in preventing such things.
Thank you very much.
Okay.
And I know we will have many episodes. We are going to educate women because the women health care really needs a lot.
Sure,
and
sure.
I believe this specific episode is going to help somebody who knows somebody who is pregnant,
Sure.
or they are pregnant, or they are planning to be pregnant, and they will do what is supposed to be done.
Sure.
And I urge you outside there, if you know somebody, please give this information so that they can learn, and so that we can save lives and people can support each other. And for the men outside, you have heard, we have football in the hospital, so
Yeah.
you have been taken care of. Support your partners.
Yeah.
And he's leading by example, so we might open a WhatsApp group. I am
Yeah.
lying.
You never know.
You never know.
Yeah.
So thank you so much for watching this episode, and may God bless you. Remember, you're the light, and this is Shine with Njoki Kamanja Kethi.
Shine with Njoki Kamanja Kethi.